According to the CDC, in 2015, 351 Mississippians died from an opiate overdose, up from 336 the year before. While Mississippi hasn't experienced the wave of overdose deaths that other states have seen, there is still an extremely high level of opiate prescriptions written in the state each year. In an effort to fix the problem before it gets any worse, emergency rooms across the state have implemented new guidelines in hopes that less Mississippians will become addicts.
The opiate crisis is no longer a secret.
Well, I'd say it's a huge problem. Probably 30% of the patients we encounter are on chronic opiates.
An estimated 2.6 million Americans are addicted to opiates.
Opiate addiction is one of the hardest addictions to combat because not only are they mentally addicted, they're physically addicted.
Fatal opiate overdoses have quadrupled in 15 years to about 33,000 a year.
This affects our communities. This affects our children, grandchildren, nieces, nephews. If we keep turning a blind eye to it, we can expect to see more people dying.
In an effort to slow down the spread of opiate abuse here in Mississippi, Jeffrey Harvey with Region 9 Mental Health Services, who is a recovering addict himself,
don't put drugs in your body,
has been going to schools around the metro, talking to kids as young as 7 in hopes that they don't become a part of a growing crisis.
I'm from the inner city. I was born here. And I honestly think I was born an addict. I go out and advocate on behalf of you can have a life. What are you willing to do? And the key answer I look for is whatever it takes.
Harvey says what has made the fight harder is how easy it has been for addicts to get opiates. In the last 15 years, the CDC says the number of people seeking help for chronic pain has not increased. However, the amount of prescriptions written that have opiates has quadrupled, prompting the CDC to introduce new guidelines for prescribing opiates for pain.
It's important for all healthcare practitioners to evaluate their personal practice and to try as best they can to adhere to those guidelines such that we're not unnecessarily creating addictions among patients.
Over time, they become addicted, from 1 pill to 2 pill to 3 pill to full-fledged addiction.
That is where Ikoko Onima, a peer support specialist, steps in to help those already battling addiction find a way to break free.
You have to be willing, and recovery is work. It's not something that just happens. And so I think a lot of times, especially with young people, they don't realize there's some action involved. You know, you have to change some things. You have to change those people, places, and things. You have to get honest about what's going on.
I have lived a life that wasn't worth living. And I honestly didn't want to live anymore. I had help with people who do the exact same thing I do, to reach their hand out to me and tell me, you can have your choice back. And I feel morally obligated to do the same thing for somebody else. Drugs is bad. Give me some. That's a big one right there. Give me some.
Harvey says he visits around 10 schools several times throughout the year, talking to kids about staying drug-free. Region 9 Mental Health Services provides substance abuse counseling for everyone in the state. They also provide therapeutic services to children in Hinds County between 3 and 18 with emotional and behavioral problems.